So this is the second part to our interdisciplinary team presentation. We have talked a little bit about the role of the dietitian, the nurse, the physician, and the hospital administrator. And this is going to include some other health professionals that you will be collaborating with on a daily basis for your patients. And they're just as important as the other four that we talked about in the previous lecture. It's just that these are not included in the article that I wanted to highlight that is on Blackboard for you. So, the occupational therapist. These individuals can be found in any setting throughout birth to death, working with different kinds of people. And they really focus on helping people get back to doing the things that they enjoy or helping them do the occupations. And that can be playing, it can be work, it can be going out and gardening. So the things that they enjoy to do, whether they be a hobby or whether they be for money or whether they be for a job, it's something that they like to do, and that's their occupation. They give individualized goals based on the patient, the family, the environment, what their current ability is, and they sometimes will use adaptive equipment to do that. And when we go through some of the lectures throughout this semester and next semester, we'll bring up some of those adaptive type of tools, but you'll use them a lot if you have a patient who has problems holding forks or they can't seem to pick up or open cans. So they'll have some adaptive devices for feeding, for food preparation, for sitting at tables that you'll use a lot with your patients. Physical therapists, on the other hand, are more kind of geared into physical movement. They may be working with people to prevent disability or immobility, or they may be working with people that already have a disability, already have problems with their movement. And it can be, you know, this movement creates pain, or I can't move this at all. So they are doing a lot of teaching. They do a lot of stretches. And if you've ever been to a physical therapist, it might have been for, well, I had surgery on my knee, and now I need to regain my strength and movement in that knee. So they are also providing individualized instruction. If you have a patient who, I'm trying to give an example, maybe you want them to be able to eat better following surgery on their shoulder, and they need to build up some strength so that they can cook like they used to or grab things like they used to. So that can be a little bit of you know, how you would work with a physical therapist. And there's lots and lots of different things. I mean, you need to make sure that your patients are strong enough to sit up and eat, to prepare foods, to stand at the stove and maybe cook when they couldn't do that before. Speech language pathologists work with people who cannot communicate well or cannot swallow very well. And we will have a friend of mine who's a speech pathologist come in and talk to us a couple of times this semester. And you'll work with them a lot if they have problems with swallowing. If your patients have had a disease or an episode where they cannot swallow very well, your speech pathologist is going to come in and treat them and help them with maybe some adaptive type of strategies to help them be able to swallow their foods safely so that they don't get pneumonia or so that they don't choke. Now, they work with speech a lot too. If you have a patient who can't enunciate very well, then they're going to work with that, but it's not as nutrition related as the swallowing issues might be. A social worker, and this is a little bit different than a case manager, but sometimes they're confused in the healthcare system. So a social worker is specifically has a degree in social work, and they're almost like a psychologist in a way. I mean, they're looking at the individual patient, the environment, their family, their finances, their disease. They may be helping them find resources in the community. They may be helping them manage this, oh no, I have a disease now, my whole life is going to change. So they really work in a whole lot of different ways in healthcare to help patients, you know, learn to live with this new disease or this new condition that they might have. They may help with placement. If you have a patient in the hospital that's going to go to a nursing home, they may help find that nursing home. They may help find, equipment for that patient so that they can actually go home instead of going to a nursing home. So that's a lot of what a social worker would do. Now, a case manager is a little bit different. They may be finding resources in the community. They may be assisting with placement into nursing homes, but they are not often, they don't a lot of times have the background of psychology like a social worker would. The case manager a lot of times may be a nurse. It could be another health, like a health informatics type person, somebody who's been trained to help people with chronic diseases. But they're not as good at kind of the counseling aspect that you would get with a social worker. So their roles are a little bit different, although you'll have both of them in a clinical setting. The social worker is more helping the person kind of manage their disease psychologically, physically, financially, in all those regards. The pharmacist. So you guys should be familiar with this. You've gotten drugs at Rite Aid or Walgreens or wherever before. You've had interactions with them. They dispense drugs. The one thing you may not know is that there are kind of different kinds of pharmacists. A PharmD, which is a doctor of pharmacy, is the only pharmacist that can actually write prescriptions. And a lot of times in the hospital setting, when you are working with a pharmacist and rounding with the pharmacist, those are going to be PharmDs. Because while the physician may be writing a lot of orders, the PharmD, that pharmacist can go around with the physician and actually change the physician's orders. So if the pharmacist in the hospital notices that, well, this patient's on 3 drugs that basically do the same thing, I'm going to take them all away and give them this one, they can do that. The PharmD can do that. A pharmacist without the doctor of pharmacy cannot technically do that. They have to dispense whatever the physician writes for. The other thing the PharmD might do, and even pharmacists will do this too, is educate a little bit on food and drug interactions. So we'll talk a lot about this in the coming weeks, but what foods they should avoid while they're on this medication. But what you do kind of above that is then give them suggestions now that they can't eat it. So if I can't eat this certain food, the pharmacist will tell me that, but they won't give me any strategies for, now that I can't, what should I do? They just say don't. So they kind of have one area that gets a little bit into what we do, but they definitely can't go into the details like we can. They may help manage nutrition support. Now we'll get to nutrition support at the end of this semester, but in some facilities, they'll be on the nutrition support team with the dietitians, and you'll be working closely with them, giving patients tube feeding or TPN, which again, we'll talk about later in the semester. Some hospitals, the Boost, the Ensure, all of the tube feeding formulas, TPN formulas come out of pharmacy. Not every hospital, but some of them. And so you may be contacting the pharmacist to say, well, such and such patient needs to make sure that they get Boost 3 times a day. Or this patient really needs this protein powder mixed in with their oatmeal every morning, and it would come from the pharmacy. So it just depends on the facility. Not all of them do it that way, but some of them do. There are other healthcare people that you may work with in the hospital. For example, a chaplain. If you're at a hospital that's affiliated with a church or a denomination, you may have a chaplain that comes in and rounds with you. So there's lots of other people that come in and out. And again, the whole purpose of an interdisciplinary team is that everybody uses their strengths. Dietitians use our strength of understanding food. Pharmacists use their understanding of drugs. We all work together with our strengths to look at this person from every single angle and say, okay, what can we all do working together to make sure that this patient, 1, feels better, 2, feels better for a real long time, 3, helps the family feel better about what's happening, and 4, keeps that patient out of the hospital. So what can we do to improve quality of life, to make sure that this patient manages and is free from disease? So again, we're all, on this ship together to work as a team.